my name is Maria. I'm a level 1 nursing student and I was scheduled to be with Mr. Levi today. Is it okay if I shadow you?
Oh, of course, it's okay.
Okay. Can I just have SBAR on the patient?
Sure. So, this is Mr. Levi Restivo. He is 67 years male. He is 171 pounds, and this is room 620, so you know. Okay, so his primary diagnosis is stage 2 diabetic ulcer on his right heel that is not healing in the last 3 weeks. He has diabetes mellitus too. He is over 20 years insulin dependent, and he was running blood glucose over 300 for the past 5 days. What's usually being manageable around 120. So he is alert and oriented ×4. I did a neuro assessment, intact cranial nerves, perla. He did have some tingling bilaterally, so we need to make sure we help him. Tell him to call us if he needs to go to the bathroom, and maybe you can help me with that today. His lungs were clear on auscultation. I was able to hear S1 and S2, no murmur. Abdomen flat, symmetric, bowel sound in all 4 quadrants. No problems with urination and bowel movement. We did check urine specimen. It was clear and yellow. He did reported pain, 6 out of 10, around 15:30, and then we gave him some morphine. At 16:45, when I reassessed him, it was 1 out of 10, so the medicine worked. That's good. He is allergic on tetracycline, peanuts, and dog hair. And also, we checked his vital signs 3 times already. The last vital signs, his blood pressure was 132/70. He's usually taking lisinopril, but he ran out on Sunday, so he did not take any medicine since Sunday, and today is Tuesday, so we're going to be giving him his blood pressure medicine also. Respiration rate was 16, vitals, heart rate 76, 96 oxygen saturation, and his fever was 100.1, so he's running a slight fever. We believe that he has infection. Labs, elevated white blood cells, 19.500. Hematocrit and hemoglobin low. Calcium is also low. The other results were pretty much in normal range. His blood glucose at 16:45 was 290, so we will be giving him insulin also. He needs that. And wound care 2 times. We're gonna clean and irrigate it with a 0.9 normal saline. And he also has IV in his right mid vein. So that's about it. The other assessment that I provide was swallow, because he needs to take some pills, so I make sure that he can swallow, and that was he was able to swallow. So
Okay.
that's about it.
That's it.
Any other
Okay.
questions about?
Yeah, I actually did have a few questions about the meds. Why specifically is the client receiving these meds, and what actions do they have on the body?
Okay, so we're going to give him his lisinopril to lower his blood pressure and keep it in a normal range, 120/70, that's a normal range for blood pressure. Then we're going to give him insulin to bring his glucose level down to normal levels. And we're going to make sure that he has his food in like 30 minutes. When we administer insulin, this is regular, it's short-acting insulin, so 30 to 45 minutes he needs to eat after administration of insulin. And vancomycin is antibiotic, it's going to fight infection.
Okay, what effects do those have on the body?
What effects? How they work, you mean?
Yeah, how do they work in the body?
Okay, so lisinopril is gonna prevent angiotensin 1 to become angiotensin 2 and vasoconstrict the blood vessel. So it's gonna lower his blood pressure and his heart rate. That's ACE inhibitor. And insulin is gonna, insulin, you can think of it like a key for our cells. So it's gonna open the cells, pull the glucose outside of the bloodstream and give it to cells for further use, energy. And vancomycin, it's gonna attack bacterial cell wall, and it's gonna inhibit synthesis, and that's how it's gonna destroy cell, by damaging cell wall.
Okay. And when would you question administering the medication?
We would look at the levels, like we checked blood pressure, we see that blood pressure is high, and we will administer. If the blood pressure was low, or we would like withhold medicine and call provider and ask for further instruction. Same thing with insulin. If the levels were pretty much normal, we would not give him insulin. And Benko, we are looking at a peak and trough. There is a levels, but since this is his first time getting vancomycin, we are going to check the levels 30 minutes after we administer drug, and then we're going to send it to lab to get the results. So that's going to be for our future administration level of peak and trough.
Okay, and then do these medications have therapeutic serum level?
Yes, so normal blood pressure 120/70, right? We want it like around that range. Blood glucose 70 to 110, and peak and trough, peak 20 to 40, and trough 5 to 10.
Okay.
So,
And which vital signs must be monitored?
for lisinopril, blood pressure; for insulin, blood glucose level; for Vanco, peak and trough levels, because of the very narrow therapeutic level that this drug has. So we want to make sure we don't cause toxicity.
Okay.
Mm-hmm.
And which physiologic parameters should be monitored when the medication is being administered?
So physiological parameters, like with the vancomycin, we would monitor flushing. Rash is a very common sign. It's called Renman syndrome. And we would also monitor changes around IV site and hearing. You know, if there is any reaction, the patient would experience hearing issue. With the lisinopril, the changes would be dry cough. That's like side effect of that drug, and also change in taste or dizziness. And for insulin, we would watch for signs of hypoglycemia, dizziness, cold and calmness, clammy skin. So those are the changes, physiological that we would know.
Okay. What interventions must be taught to ensure the medication is administered safely in the hospital?
So in a hospital, we're going to watch the levels, watch the vital signs, make sure with the insulin we rotate the sides of the injection. In a hospital, we do still use alcohol wipes. Home, they can just like do a regular hygiene. With the Vanco, we are going to make sure that we give a patient call light so they can call us if they're experiencing any burning around IV site, or like changes in a neck and a face, or hearing. And we need to make sure that the IV is like in the vein, that doesn't go paravenous. It can be like dangerous for the cells around. With the lisinopril, we need to make sure the patient's able to swallow. As I told you, we did assessment on him that he can safely swallow, so we don't cause choking or something.
Okay, and what about at home?
At home, the most important thing is adherence to the medication. He did have an issue. He did not take his medicine since Sunday. His blood pressure was really high when he came in, and then he ran out. For antibiotics, so important adherence to take whole course of medication, and insulin, to check the blood glucose before administration, check postprandial blood glucose, pretty much adhere to the regimen medication.
And then what are some side effects and potential adverse reactions?
Side effects with Evenco, definitely red band syndrome, rash in the neck area, face, changes in hearing. With the insulin, any signs of hypoglycemia, dizziness, cold and clammy skin. With the lisinopril, if he starts experiencing changes in a taste, dry cough, you know, those are like unwanted reaction of the medicine.
Okay, and then how will you know when the medication is effective?
Well, so our usual is like after administration, we would come back in 1 hour, check the vital signs, see how did medication work for blood pressure. Insulin, we would check blood glucose. For Venco, we're gonna monitor changes in wound, white blood cells, temperature. If it, you know, gets better, gets not closer to normal levels, that means the medicine's working.
Okay,
All right.
and that was all my questions for now.
All right. Are you ready?
I'm
to go
ready.
meet? Okay. All right. Okay. All right. Knock.
Yes, come in.
Hi,
Hi.
Mr. Restivo. I have a student nurse from SPC College. Is it okay if she spends some time with me today, watching me, taking care of you and giving you a medication?
Sure.
All right, thank you, Mr. Restivo.
All right, let's wash our hands. All right. Okay. So this is the most important thing in prevention of infection. You want to wash your hands when you come in, when you leave the room, in between interventions. Okay, that's very good. All right, now let's check the band. Can you tell me your first name, last name, and date of birth, please?
Yeah, it's Levi Restivo, and my birthday is March 3rd, 1950.
Thank you. And I see allergy bracelet over here. Can you tell me your allergies, please?
Sure. I'm allergic to actually dog hair, peanut, and tetracycline.
All right. Okay, thank you.
Yep, no problem.
So, first thing that you want to go, you want to go on the charts. And what we want to do, we want to check providers' orders, right? We want to make sure that the medication that we pulled in the pixels and we check is exactly what's still in the chart. So first thing that we would do before we do it, you want to make sure that you have right patient, Restivo Levi, right? And we look for allergies. So here's tetracycline, here's peanuts, dog hair, right? Okay. So we have right patient, we know the allergies, we're gonna go to providers charts, we're gonna look at orders. All right, so we are planning to give insulin, and there is a sliding scale. We would administer because his blood glucose level was 290, so it tells us that we need to give him 16 units of regular insulin. And we would consult provider if it's over 301. For lisinopril, we have 10 milligrams by mouth daily, and we have that medication, and also vancomycin 1.5 gram intravenous. So we check that. The next step that you want to go to your vital signs and make sure that we have like blood pressure 132/70, so we will be administering lisinopril. We will check one more time blood glucose to make sure those are the last readings. Yep, 290, 60/45, so now it's 17. We're gonna administer that. Okay, then EMAR. This is where our medication is, orders. Okay, so we can start with the lisinopril, but let me talk to Mr. Levi about this medication. Mr. Levi,
Yes.
I have a couple questions for you before I administer your medication.
Okay.
Can you tell me like 2 side effects of the medication that you're taking?
I really don't know.
You don't know?
No.
Okay, so what I did, I printed some information for you,
Okay.
and I highlighted some side effects and changes that you need to monitor just in case if it happens. Like with the lisinopril, I want you to monitor changes in taste and any experience of dry cough, dizziness.
Mm-hmm.
Okay. With your vancomycin, flashing on your face, rash in the neck and head area, or changes in a hearing. Okay.
Okay.
Yeah, that's really serious medication. You want to monitor that. And with your insulin, any signs of hypoglycemia, dizziness, cold, clammy skin, want to make sure that that doesn't happen. If it happens, you need to call provider, okay?
Okay.
All right. So I'm going to leave this next to you, and I'm going to check later on you about this, okay?
Okay.
All right,
Thanks.
I'm going to put it right here. Okay. All right, so we just told him some side effects, and you know, just in case if it starts happening, so he knows that he needs to call us, right? Okay, so listen up, bro. All right, so one more time, name, last name.
Sure. It's Levi Restivo, and my birthday is March 5th, 1950.
Okay, allergies.
Dog hair, peanut, and tetracycline.
All right, thank you. So over here, we're gonna. So we have lisinopril, 10 milligrams oral once, and I already checked, but I want you to start practicing it. It's so important to make sure that the levels that you are gonna give are appropriate for the patient. So would you like to go and check for lisinopril?
Sure. Looks like 10 milligrams once a day is
10 milligrams once a day, that it is. Okay.
And what time is that at?
It's 17. So,
Okay, right, we're given, okay.
Yes. So we are giving it 17, 10 milligram oral once a day, and it was not given today, so we're okay to give it.
Okay.
Okay, and then now we want to make sure that the drug that we pull is the one that's actually what the order says. We want to make sure we have expiration date, right?
Okay.
And so, okay. All right, so Mr. Restivo.
Yeah.
Can you read your patient ID for me, please?
Sure. It's 686
686
764
764
5607.
5607. Okay. And then we're gonna put this code. That's the 91 FA 329 CF DF 40. Okay, so we have a green light. We're safe to administer this drug. Before we do it, we're gonna just one more time. You wanna wash your hands, okay? We want to put the gloves, you know, when you're administering drug. That's it. Okay. All right. Takes a minute for hands to dry, so you can put the gloves on. Okay. Okay. All right, so we have a right drug, right dose, right route, right time, right patient. All right, so followed like expiration. Okay. I'm gonna give patient some water. Okay, Mr. Restivo, here's your lisinopril.
Thank you.
Okay. All right, let me see, open. All right, thank you.
Mm-hmm.
All right, so, Okay, so administering time, we administer it at 17, right? Okay. So we administer 10 milligrams orally. Patient had no issues swallowing. No issues swallowing.
There is no indication of amoxicillin or
Okay.
so I don't want to make an assumption, so
Alright.
maybe the doctor can be
And my
going
initials.
back and say it is
Yeah.
okay to
So we're gonna save this. Okay, so next medication that we want to get is insulin. So for insulin, we it's same thing in the drug book as over here. We have a sliding scale, so we're just gonna hover over it.
Would you like me to check
Yes,
that?
yes. But I just want to find it so we can compare it.
Okay.
All right, right here. So it says blood glucose between 241 and 300 would be 16 units. Let's look over here in our
And
book.
what was his blood sugar again?
290.
Okay.
Mhm.
So it says the dose depends on blood glucose response and many other factors.
Okay, so we're in the range, so we're gonna administer 16.
Okay.
Okay. All right. Now we're gonna take our insulin. We're gonna check against EMA. We're gonna check expiration date. Make sure it's a clear. All right. The time is 16:45, so it's subcutaneous, and now it's 17. So, and with this drug, we make sure that he has his tray in 30 minutes,
Okay.
so he can eat. Okay, Mr. Levi.
Yeah.
Can we have your patient ID number again, please?
Yeah, 6867
68
6456
6456
07.
07. Thank you.
Uh-huh.
All right, and medication is B9, C9, C8, 7B, 9B, 0B, A4. Okay, we have it going live. Let's check one more time. First name and last name, please.
Restivo Levi.
Okay, date of birth.
March 5th, 1950.
Okay, and allergies.
Peanut, dog hair, and tetracycline.
Thank you very much. Okay, so we're all good over here. So we want to make sure we clean the vial. Okay. Okay, so we need to give 16 units, so we will pull 16 units of air, and
Yeah, sometimes the school
Put
don't
it
get to do
in
this
a vial,
so
and then
if they go that
pull it
way,
out.
if we had a scanner, it would have been easier
Okay.
to get it in, so.
Would you double check this for me? Is it 16 units?
16 units.
Thank you. All right. Scooping method, right? We don't know another cup. Okay. All right. Are you ready, Mr. Esteban?
Yeah.
Do you remember where was the site of the last injection?
Yeah, it was on my lower left abdomen.
Lower left. Okay, so we're gonna go upper right. All right. You want to clean the area a little bit? Allow it to dry. Okay. And then just administer insulin. Hold it for a couple seconds, and that's all it takes. This goes right away to sharps. No recapping. Okay. Alright. And then we will record administering time. Okay. The dose we administer 16 minutes. Okay, of regular insulin. Regular insulin. That was right upper corner, right? Upper corner. Okay. My initials.
So
And the
sometimes
last
we
one
have problems
was-
like these,
Yeah.
if we don't have a
Last
scanner.
blood glucose was
So we're gonna be giving this,
290. 290 at 1645. 1645. Okay, so that will be it. Okay, let's change our glass. You wash your hands? Yes, no? Alright. Okay, so now what we're gonna do, we need to administer antibiotic. So we're gonna hook the prime line with a 0.9 normal saline as a primary, and then we're gonna add a secondary line with a piggy bag of vancomycin. But before we do that, we need to make sure that IV is intact, you know, and it's in a vein. So we need to flush the line, okay? All right, okay, so we will double check how, any pain around?
No.
Okay, see, it looks like dry, nice, intact. Okay, I'm gonna flush your line, Mr. Restivo, okay?
Okay.
All right. So, okay. Over here. Okay, sodium chloride, it says 30 milliliter per hour. So we're gonna, when we start to doing that, okay. It's just making sure that I have ordered for IV for normal saline.
Okay.
Make sure
Okay.
everything I'm working with is clamped. And you can see that's clamped. Clamped right there.
Alright, so. Alright.
It's clamped right
Okay.
there.
You wanna scrub the hub for 15 seconds. Make sure this is not clamped. Okay. Aspirate a little bit. Make sure that we are in a vein. Okay, and then push it. Any pain?
No.
Okay. All right. So that's good. You can leave it right there. Alright, so now we're gonna do normal saline. We checked it, 30 milliliter per 1 hour. It needs to go. Side is okay. One more time.
Yeah.
Name, last name.
Restivo.
Levi.
Levi Restivo, and my birthday is March 5th, 1950.
All right. Can you tell me your allergies one more time?
It's peanut, dog hair, and tetracycline.
Thank you. All right. So, and I'm gonna need your ID number again.
Sure. It's 686-764
784.
645607.
Since we don't have a pump, we're going to be using the valve.
Okay, so we have information.
So I have to connect this.
Okay, we're gonna look at our normal saline. It's D9,
Thank you.
B9, B9, B9 is 02, 96, 96, 683, 683, 99B. Okay, B9. B9. Okay, B9, B9. 02, 986, 986, 83, 986. I have over here 986, 83, 83. Oh, so we got the green light. So we're gonna administer this at 30 milliliters per 1 hour. We're gonna use also dial flow with this infusion because we don't have a pump. Usually we would put it in a pump, okay?
Okay.
All right, so to do this, we need to use our tubing. Okay, Make sure it's not kink, it's not like tight. Okay. Maria, I'm gonna need your help a little bit over here. Just like need to untie this. Okay, it's okay. All right, we have this. Okay. So, all right, we do this. Still closed. Sometimes manufacturer can come like that. Thank you very much. So this is closed and sterile. This is closed and sterile. We're gonna make sure we close the. All right, and then this inside part is sterile also. So when we spike, we need to make sure we're not touching. Okay. All right. Okay. Fill like half of the chamber, and then because I'm gonna be using dial full, I'm gonna add it right away. So, you know, I can prime it together with this. So what you want to do, you want to clean this. Okay. And you want to clean alpha. Clean alpha. Okay. We're going to add this.
She doesn't want to go anyway.
Make sure it's closed. Over here, we'll make sure that this is open, so we can flash it. All right, it says open, and then we can actually put the bag up there, so we can flash it. You want to make sure you make the lines free of air and the liquid's like running out of the tube. All right. So that's good. We have that. And then over here, because I had the syringe, I'm just going to take this out and connect it. Okay. Okay, set it, 30 milliliters per hour. And I'm going to open the line and watch for 5 drops. I'm gonna make sure that there is like 5 drops. Any pains, Mr. Stevo?
No.
All right.
Thank you.
Okay, so over here we wanna, this is right medial vein. Time is 1700s. We're gonna line flash. Make sure that we write that IV line was flashed. IV line flashed. Flashed. It's running 30 milliliters per hour. Okay. And my initials.
Yeah, you can have this on the table and use this on your next.
All right.
You go.
Okay.
I was trying to.
Hit this first.
So our next medication is vancomycin. We're gonna do the same thing. We're gonna check the book for safe use of the drug. Okay. All right.
All right.
All right. One more time. Name, last name.
Restivo.
Mm-hmm.
and it's March 5th, 1950.
All right, thank you.
Looks like the safe range is up to 4 grams a day.
4 grams a day. We're gonna check the medication. Make sure that expiration date's good. It's ordered 250 milliliter per 2 hours, so we're gonna set our dial flow 125 over 1 hour. Okay.
Okay.
All right. So the dose is safe.
The dose is safe.
All right.
This person,
All right. And it says 1,750 milligrams once a day. 1,700, so we're good. Okay. Mr. Restivo,
Yeah,
do you have any allergies on the penicillin?
not that I know of, just those three that I mentioned, which was the dog hair and the peanut and tetracycline.
Oh, okay. All right. So, okay. Okay, I need your ID number again, please.
Sure, it's 68676 456
456
07.
07. Okay, we have the name. It's right name. We're gonna do a medication barcode. B9B0 F7 4427 BCDA. Okay, so that's the right patient, right dose, right time. Okay, so what we're gonna do over here, Maria, we're gonna add the second line. Same principle as with the main line. Make sure we're not, we keep sterile field, we don't break sterile field. Fill this. We want to make sure with this drug, because it's such a small amount of drug, that when we prime it, we don't lose a lot. Just prime it enough to take air out of it, okay?
Okay.
Okay. All right. Okay, so what we will do over here, we will attach this so the secondary line can be higher and goes first. So we'll make sure we do that. And the secondary line is going to be higher. And we are going to add it to the top portion of this. Scrub the hub, 15 seconds. We'll open this, add to it, and let it run. Make sure we have 5 drops. Okay, 1, 2, 3, 4, 5. Any pain, Mr. Restivo? All right. Okay, and then we're gonna change over here, flow to 125. All right. Okay.
No, I don't feel any pain. Thank you for
Open
asking.
this. Okay. All right. So this is running. This should be good. Okay. I'm gonna put your call light right here. Call me if you start feeling any changes. Okay, as we talk about.
Okay.
All right. Let me just record this, and then we'll talk some more about your medication that you're receiving. Okay. Okay. Also, one more thing that we need to do is like to label our tubing. So I'm gonna put today's date, that okay, time 17, so the next nurse knows when to change it. Okay, so we're gonna add some labels to our tubing. 17 initials. Okay. All right, and we're gonna add to this one. All right. Okay, so now we're gonna record our time and minutes here. We submitted 17. Comments. We checked for allergies to penicillin. What is the penicillin? Penicillin. It is right medium vein. right medium pain. And it's running 125 per 1 hour. Okay. 125 milliliter per 1 hour. My initials, we're gonna record. This is size 20 gauge. Okay. Alright, so that would be it. Okay. Mr. Estivo,
Yes.
do you have any pain?
No, not at the moment.
Not at the moment.
No.
On a scale from 0 to 10, what is your pain?
I would say it's about a 1.
Okay. All right. I'm gonna record it. Let me know if it changes and if you need anything for pain. Okay. Okay. Let me just do assessment over here. Patient charting. Go to patient charting. I'm gonna go to patient charting. Special chart. Just want to record that he said that he has a pain at 1700. At 1700, that pain level 1 out of 10. So we are monitoring that for his pain 1 out of 10. Okay, let me save that. Okay, all right. Mr. Estivo,
Yeah.
are you ready to talk about your medication that we...
Oh, sure. You mean the side effects from earlier?
Yes.
Okay.
Here's a little
think I
test for
remember.
you. What can you tell me about your lisinopril?
So for my lisinopril, it's if I experience for my blood pressure, right? And then if I experience any like change in my mouth or coughing, dry cough, to definitely let you guys or feel dizzy to let you guys know, right?
Okay, very good.
And then
You see?
yeah.
All right, vancomycin.
And for vancomycin, if I feel any like change in my hearing, and if I feel any flushing in my face, to definitely call you guys.
Excellent, excellent. And how about your insulin?
And for my insulin, I would let you guys know if I feel any dizziness or if I feel cold and clammy. Yeah.
All right, very good. There's like a lot of information over here. I'm gonna leave it for you so you can read later about it.
Okay.
Okay, I'm gonna put your bed down.
Okay.
All right, and you have your call light over here.
Okay.
So you call me if you need me.
Thank you.
Okay, and we're pretty much done over here. Okay, gonna log out. Before we leave, we have to clean everything, right? Make sure our area is clean. Really work. Okay, this pen. Okay, all right, and then okay, so record this with me. Okay. All right. Okay, Maria. Mr. Estivo, have a good day. Call me if you need something. I'll be checking on you like in 1 hour. Okay? Maria, before we leave, we want to make sure we wash our hands.
Thank you, Mr. Estivo.
There, you're welcome.
All right.
Get sleepy.
Okay. Any more questions?
Yeah, I did have a few final questions. Were there any pertinent pieces of information you reviewed before administering the medication?
Yes. So if you remember, we went to the patient chart. We make sure we have right patient, we have right dosage, right amount, right? We check their vital signs. We checked blood glucose before because we administer insulin, right? Yeah, we make sure that there is provider's chart, like in there, that you know all the medication that we're giving is correct.
Okay.
Yeah.
And does this information affect your decision to administer the medication?
Yes, yes. So if he had normal blood glucose level, or less than 290, I would follow sliding scale and I would administer the amount according to sliding scale. Listen April, if his blood pressure was okay, I would withhold medication and I would like call provider and for further. And vancomycin, if there were like a different amount or ordered what I have or something, any other issue I would call.
Okay, and then did this information affect how you administer the medication?
Yes. Yes, so insulin, this is regular insulin, and this insulin can be also administered IV. So if his blood glucose was very high, I would call provider and ask maybe if we need to administer it IV, or if patient was not able to swallow, there is also medication that we can give by some other routes, blood pressure. So we would definitely communicate with the provider and make sure that we're safe what we're doing. Okay.
Okay, I think that's all the questions I have.
All right. Thank you, Maria.
Thank you so much for letting me watch you.
Thanks.